It's 14 minutes past 10, and this is coffee break. You know what, Dr. Seshni? I was just about to say this is HRB breakfast. It feels weird, doesn't it?
It does. At this time of the day, definitely it does. Yes.
Yeah, I know, but from now on, just because I've been busy in the mornings and all that, so we thought that, yeah, might as well just take Jeff Clark's coffee break. And these are big shoes to,
So is this the coffee break show then, is it?
So this is the coffee break.
Oh my goodness, you won't believe it. I That is so freaky because
Yeah,
yeah, no, that's amazing to hear. Amazing.
yeah. So that's where we are now, and I drag you wherever I go, don't I?
Yes, exactly. And I am drinking. Why I said it's so freaky because I'm drinking my coffee and I'm just
Yeah, I just
thinking
finished mine actually. Finished mine.
so we can have this coffee chat, which is amazing. Thank you so much.
Amazing.
Please have yours ready next time.
Yes, definitely.
I miss the studio days where we used to bring the coffee in the morning.
Yeah,
Um,
we'll start going back soon.
hopefully, hopefully.
Hopefully.
So, how are you doing? How was the weekend and how was everything?
Not too bad at all. How was yours?
No, it was fantastic actually, really good. I was at the Light Center, the Sukyo Mahi Curry Center on Saturday with the girls. We took a train journey, very busy into London as always. And yeah, but a lot of people are sticking to the guidance, I would say. People are still wearing masks and but I think in the underground it's not possible to maintain distance as you would like, but in the normal trains, overground trains, it is possible. Most people are keeping their distance. But obviously, during busy times and peak times, it's not always possible. But I did see a lot of people still wearing masks in central London and in the Croydon area that we were at.
Yeah, that's great. It feels as if we're going to be talking COVID, but not today, not this time.
Okay, yeah. Yeah, no, World Mental Health Day. So that's fantastic. And you did talk
Yeah,
about that yesterday already.
absolutely, absolutely. So you're watching us on Facebook Live, and
Yeah.
you're listening to us on Hospital Radio Bedford. I've got Dr. Seshni Moodliar, consultant psychiatrist, and this morning is all about mental health. The 10th of October is Mental Health Awareness Day, isn't it, Dr.
Yes.
Seshni? And well, first of all, I'd like to ask you this broad question: what does it mean when you say mental health? We know what physical health is,
Yeah,
eh,
very, very good question because actually the theme of this year is about good mental health. So, what is mental health? So, exactly like how we take care of our body, we need to take care of our physical health, is what we call it. Our body.
mhm,
We ensure that our body is in good working shape and condition, by exercising, eating the right foods and having the right diet, taking medication if we need to, if we have any physical health problems. It's the same thing with our mind, and we know that our body and mind is linked. So whatever happens to our body affects our mind, and whatever affects our mind affects our body. And I'll give an example in a bit. But going back to mental health is exactly what we do for our body, we need to do for our mind. So we need to ensure that we're eating healthy, we're taking care of ourselves, we are also ensuring good mental health so that we are not experiencing symptoms of mental health disorders. So there's a variety of mental health conditions like depression, which is as common as a flu. 1 in 4 people experience a mental health condition. So there's bipolar affective disorder, there's schizophrenia, anxiety disorders, OCD, grief. We've seen a lot during the pandemic.
yeah,
PTSD, post traumatic stress disorder. I mean, and the list goes on. I've written a book about it. So there's a lot of mental health conditions. And so, what we need to do is we need to promote not just physical health, not just taking care of your body, but taking care of your mind. And also, I think I just want to emphasize the theme of the World Mental Health Day, 10th October this year, is fantastic because it's about reducing stigma. Stigma is something that I personally have been trying to raise awareness about mental health, awareness and talking about these conditions. And I think also promoting, the phrase, it's okay not to be okay.
okay. Right, let's go back to the very basic mental health question. Right, until very recently, I I thought that um, the person, the woman know, the man that I see on the street or in the house behaving funny and attacking people and all. I thought that, yeah, well, that person must have mental health problems. Apart from that, nobody else has. But I've come to find out that that's not exactly the case. That people have different mental health situations where they don't have to necessarily act in those ways that I expect them to. Now, how do I know that a person has mental health problems, especially if I want to help them?
Very good question, and I think this is what also raises um, and reduces the stigma of mental illness. The more that we can educate people about the different symptoms and signs, psychoeducation of different mental health conditions, the better everyone will be equipped to take care of people and also to be able to identify if someone's got a mental illness and then signpost them to the right help. So I think that's a fantastic question. How do we know if someone has mental health problems or mental disorder? So there's different ways in which we can identify it. But I think if we are talking about family and friends that are close to us or colleagues and co-workers in the working area, we can identify that there are telltale signs. So we can find out just from talking and listening to someone that they might have a mental health problem. So I think first and foremost, if you know someone going through a difficult time, I think listening is a key skill. And this is what the Dalai Lama, I was watching a talk with him with Oprah, and he says the key skill is about just listening to someone. So I think when we are communicating with people, it can be possible to identify that they are going through a difficult and stressful and challenging time, which may then indicate that the person has a mental illness. So just giving a person a lending ear and listening to them. The second thing is, and they might tell you, I'm going through a stressful time, I'm not able to sleep, I'm having some difficulty at work, or I'm having stress at work, or relationship difficulties, or problems with my kids, so, or I've just lost someone. So there's so many different ways in which someone can express to us that they are going through difficulty. So one is listening, and you being willing to listen and help that person get the help. Second thing is, you can see the signs, the telltale signs that the person, whether it's your family member or colleague or child, anyone that you think might be going through a problem, they might start to have sort of sleep disturbances. So either they will report it, or you would notice that they look more tired than usual. They might also start becoming more anxious and isolated and refusing to go out, canceling appointments, canceling social outings where previously they would be going out. So there's a lot of changes in a person's behavior. So where once you might know a person, they're usually outgoing, they're always messaging, they're keeping up to date, but then all of a sudden they become quite silent and isolated. Then you need to think this could be a red flag. That could be one of the
Okay,
telltale signs.
before you go on, can roles change in what you just described? Like, for example, if somebody who's very outgoing and then suddenly the person becomes quiet, can it be the opposite? Like the person is normally quiet, and then suddenly the person becomes, or it doesn't work that way. No.
No, it can. So, especially, so where people start isolating themselves is when they're going through a very difficult situation and they don't want to share their problem with others. Because a lot of the time, as we know, the World Mental Health Team is there's a lot of stigma. It's difficult also for people just to go up to someone and say, you know what, I need some help. I'm going through a really difficult time. And this is where we need to normalize mental health. That's what Oprah's been doing with the Prince Harry, is trying to normalize it where we can talk about it. And as I said, when someone starts isolating themselves, it could be a sign of depression, it could be a sign of agoraphobia or panic disorders or anxiety symptoms where they've got a fear of going out. So there could be various reasons. And on the flip side, as you said, when someone starts becoming overactive, talking fast, elevated mood, or irritable, not sleeping, getting involved in certain promiscuous behavior, and maybe overspending and starting to believe some quite grandiose thoughts about themselves, and that could be a sign of bipolar affective disorder. So there's different types of mental illness, as we've been talking on Hospital Radio Bedford. So there's obviously different telltale signs. The other things is when someone, so as I said, is one main thing is listening to someone, you can hear that they're going through a difficult time. The second thing was changes in their presentation in terms of maybe their sleep patterns. Third thing could be looking at them isolating themselves or going out too much. Fourth thing could be looking at them starting to cope with different methods. So they might be coping with using drugs and alcohol, and that has happened. It does happen. A lot of people, because they become so stressed, they can't cope. They're more vulnerable to the stresses. They don't have any help or support, and they start abusing drugs and alcohol. And obviously, then that sets a vicious cycle. So I think the aim of identifying if someone has help, Opoku, is once we are able to have those telltale signs, and you must know there will also be reports from, say, for example, children from school. The teachers might report something. Someone at work might report something to someone else. I've noticed that so and so, she's, behaving in this way, and I'm just a bit concerned about her. So, and I think this is where all the institutions, the health and well-being centers, and support systems are really important. So it's about identifying if someone needs help. So if you are the person that needs help, I think the message is you need to ask for that help. And we need to normalize it so that people going through mental health difficulties can say, I am going through a difficult time, I need some help. The second thing is then if you know someone that needs help, I think you need to talk to them in a in a confidential way. A lot of the time, whatever we discuss with someone should be confidential, and we should say that, and we should be able to trust someone. So I think that's really important, building trust with someone, getting them to open up to you, and then signposting them to the help, whether it's a GP, whether it's a psychological services, whether it's an online charity organization like Mind or children's.org. There's so many different organizations that have information and help. So
We'll talk about the health organizations and right at the end of this talk or interview. Now, I have so many questions to ask on mental health. Unfortunately, we haven't got that much time. But what I'm going to do is I'm going to ask like two or three questions at a time, and then if you take your time to, um, you know, run through them with
fantastic,
answers.
yeah.
Yeah. The first question I want to ask is how early can one, have mental health? I'm talking about age-wise. Is it can a child have mental health, for example? The second question is it can it be hereditary, or is it something that you just grab on your way? If you know what I mean, I'm using the word loosely there, using the phrase loosely, and yeah. So let's talk about these two first, and then we'll continue with some more questions.
Yeah, very, very important, very interesting questions. Thank you for those, Opoku. So yes, in terms of developing a mental illness, I think mental illness is something which can occur across the different age groups. So it can occur from as young as someone as 3 years old, and it can go up to 100 years old, so or older. So anyone in those age brackets can develop a mental illness. Having said that, we know that certain conditions, for example, if we look at childhood disorders like ADHD, autism is usually from the time the person's born that you will identify that the person has autism. The diagnosis is usually made later. ADHD, again, there's a certain age group that we look at, 6 or 7 years of age, where we start to see the symptoms, and family usually complain. It can occur before that, but we usually look.
ADHD.
So, attention deficit hyperactivity disorder.
Okay.
Yes. Depression, anxiety, um, OCD, obsessive compulsive disorder, post traumatic stress disorder, schizophrenia, bipolar. Obviously, each of these have different age brackets, but we can see some of these conditions in children. So, children from the age of, I would say, from 10 going up to 17, and 18, we can see young children develop conditions like depression, bipolar affective disorder, eating disorders, antisocial behaviors, sleep disorders, grief, any of these conditions we can see, and many more we can see in young children, PTSD, OCD, panic disorder, all of these conditions that we see in adults, we can see in children. The only difference is with personality disorder, that's usually only diagnosed after our personality is fully formed. So that you can see some emerging traits of personality disorder with children, like emotionally unstable or antisocial personality disorders or narcissistic. You can see some traits, but we cannot diagnose these until a child reaches a full adult age, and that's when we can make a diagnosis. But again, coming to your question, there'll be certain conditions in each of these different age groups, in early childhood, later childhood, in adulthood, and then later adulthood, like the dementias and the memory disorders that we will see later on. So we can get disorders in any different age group. And coming to your next question about the genetic component, yes, a lot of the conditions and most of them are hereditary. So, what that means, Opoku, for each of the disorders, we have certain conditions that, if, say, if a family member has, I'm just going to give a broad answer to this, and for each condition, when we do discuss them, we can talk about the different the different percentage for each person, the risk that they can get it. But I think what's important for people to understand is that if a person in their family maybe has schizophrenia or depression, bipolar affective disorder, or autism or ADHD, then these are just some of the few conditions, and there's a higher risk of that person developing it. So it's not to say that that person will definitely get those mental health conditions, but it just means that we are more vulnerable, that there is a gene that has been passed through, and there's a possibility that we can get it. So sometimes the disorders skip generations, meaning that they don't get affected. But sometimes, for example, if someone's mother has schizophrenia, it's possible that when they reach adulthood or later adulthood, they might develop schizophrenia or bipolar affective disorder. So there's obviously different conditions that we do know runs in family. Another thing like autism, ADHD, we know that if someone has it in their family, if they have an uncle or an aunt, then there's a possibility they could get it. It's the same with eating disorders. So there's a lot of conditions where we know that it does run in family. And I think that's an interesting question that you've asked, because I think if we know that we're at higher risk of developing conditions, I think the focus should be, like we're saying, talking about normalizing mental health, reducing the stigma, and then also preventative. It should be preventative, where we are supporting families where we know that there is obviously a high risk of them developing mental health problems.
That was gonna be my next question to ask. Can mental health problems be prevented?
Yes, I think so. Some of the conditions, unfortunately, for example, like with memory disorders like Alzheimer's, for example, we know that it's a progressive memory problem. And if there's a family history of someone who has Alzheimer's, there's a higher risk of you getting it. And unfortunately, even with treatment, we can try and help the progression of the illness, but there is no cure. So it's the same with autism, there's no cure for it. But what we can do is there's a lot of treatments available. So there's a lot of holistic treatments, which I'll explain as biological, which is medication, looking at medication. And in more severe cases, there's other treatments. There's psychological or talking therapies like CBT, cognitive behavioral therapy, or confidence building, psychoeducation, psychotherapy, all different therapies like family therapy. So there's a wide range of talking therapies, counseling, a very common one, and problem solving therapy as well. And then there's the third aspect of treatment, which forms of part of the holistic, is a social aspect. So social interventions, so like support groups like AA 12-step programs, and maybe support groups like that different organizations have, where you can attend meetings, and groups where maybe someone, for example, if you've got depression, there might be a group for depression that you can meet like-minded people, and you can get some support and help. So there's a range of treatment, and obviously alternative is something which is becoming more and more common. So looking at homeopathy, Ayurveda, reflexology, massage, alternative therapies, light therapy, is also something that's been used, Reiki, you know, any form of alternative, and spirituality is becoming also more and more important. So there's a wide range of treatments available, and as I and from in my experience, Opoku, what will work for one person might not work for the other person. So some exactly. So some people might just get better by taking an antidepressant if they've got depression, but another person.
I'm going to give you a couple of minutes to run us through treatment and therapy. But before we go to that, I I I have been to a mental institution. I'm not as a patient.
Yeah.
I'm not stressed. And I've met some of I've met some of the patients.
Yeah.
And amazing people they were.
Yeah.
What I realized was that some of them were really nice and quiet and just. I mean, you would never know that they had any mental health problems, except for the fact that they are in a mental
Yeah.
health institution. So of course the
Yeah.
authorities they know, so they diagnosed and all that. But some others, I mean, you could just tell as soon as you see them, you know there's something not right. And some of them are even really violent and all that. What happens? Why is it that some are on the extreme left and some are on the extreme right?
It's difficult to predict, for example, you know, the different severity in each case. But I think what does help is obviously if someone gets diagnosed early and gets treatment early, it reduces the risk and the complications of the condition. So, for example, for each of the conditions, we have a mild, moderate, or severe form of it. For example, take depression. We can have a mild form of depression where the person just starts feeling sort of sad, starts feeling low in mood, and maybe have problems sleeping, eating, difficulty concentration. But as it progresses more severe to the more moderate and severe cases, the person can start to have negative thoughts about themselves, about the future, feelings of hopelessness and helplessness. And then in the more severe case, they can start being suicidal and start self harming or attempting to end their life. So,
One thing that sorry to cut you in, but you just mentioned self harming, and it's something that it's quite interesting to me. Interesting, not in that way, but I I don't understand. Of course, I'm not a psychotherapist or I'm not a mental health worker or anything, but I do not understand why they try to harm themselves. So when you finish explaining what you finished, what you explained, could you please um, at least give us an idea of why mental health patients want to harm themselves?
that's so important, Apoku, because so many people are dealing with that difficulty. But going back to the question I think you asked is why do people sometimes behave in a different way or they become more so serious? And I think the problem there is it's either the severity of the mental illness and also the maybe that they're not complying with treatment if they've got an underlying diagnosis, and also it could be that they don't have the support and they don't have the treatments available. So I think the way to reduce those type of severity and the morbidity associated with it, that where the person cannot actually function and they need to go into hospital, is identifying it early and giving the right treatment and supporting people. And that's why World Mental Health Day is so important, and talking about it like this today. So it's great that we have this opportunity. The in terms of people harming themselves, yes, it is very common in mental health conditions. So, for example, in depression, as I was saying, people take overdoses or they might cut themselves. Some people end up successfully harming themselves and committing suicide, whether they
Head banging. Well,
so, self injurious behavior is another way of self harming. And that's as a learning disability consultant, psychiatrist, we see that commonly with our learning disability population. So, because people can't articulate or express themselves because of their IQ and because they've got learning difficulties or disabilities, they headbang or they cause self injurious behavior, which is biting or picking their skin or other doing other sorts of injurious behavior, you know, hitting themselves, head banging, as you said. But in terms of the other self harming, we see commonly people with personality disorder, so borderline personality disorder or emotionally unstable personality disorder, where they harm themselves. And usually the person harms themselves because they cannot cope with the distressing feelings and the emotions that they have. One of the etiology or the causes for a person with, it's not to say everyone that has emotionally unstable personality disorder has this, but a lot of them have a history of sexual abuse, so, or some form of abuse, and as a result of that they end up developing a personality disorder. But what we do know that is usually when they have a personality disorder, if they do get the right treatment, especially the psychological treatment like DBT, dialectical behavioral therapy, which specifically targets and deals with these distressing emotions, there's different components related to it. And as a result, the person can reduce their self harming and eventually stop harming themselves. But the other common one I explained was self harming in terms of person having depression where they take overdoses, or they could commit suicide, or they could throw themselves off a train, they could hang themselves. Another common, there's a lot of risk factors for suicide, Opoku, and I don't know if you'd be surprised, but single male, white, unemployed, these are the risk factors for
Really?
these are the risk factors for people that successfully end up harming themselves or committing suicide. And I think the reason why I wanted to raise that is that we can't stereotype. You know, there's a lot of research, and it's important to look at the research. Everything we practice is evidence based. Even World Mental Health Day is evidence based, and it's about raising awareness. World Health Organization, the WHO, and the Federation Organized Association, they've all raised awareness because it is important that we need to talk about mental health conditions. Everything we know is based on the evidence and what we see. So, in terms of talking about mental health, and if we can talk about it, we can help reduce the stress, get someone the help that they need, whether it's from the GP, the mental health service, community mental health teams, whether it's online help, whether it's psychological or medication or social support, or whether it's a charity organization that can help, and even whether we can get them help in hospitals, which sometimes is needed. So I think it's important to talk about this, and also we need to try and make it okay to say I'm not okay. It's okay not to be okay. We need to normalize mental health so that people that are going through the struggles can say I need the help. And I think in terms of saving lives, I think again, with pandemic, we've been trying to save lives, and everyone's protecting themselves with mask and sanitizing and whatever else they needed to do. And at the same time, we need to this for mental health, for people with mental health conditions. We need to show more understanding and compassion and listen to people, and we need to get them the help that they need. Or if a person is struggling, they need to also be able to say, I need the help. So I think that's where I would like to, sort of
Oh, that's
just
fantastic. Wonderful.
emphasize, yeah, reducing the stigma of mental health is so important.
We've got about two and a half minutes to get out, and can you quickly run us through treatments and help?
Yeah. So there's different treatments, as I said. So medication, as a psychiatrist, obviously we do prescribe medication, and it's evidence based. We know that, for example, if someone takes an antidepressant, within 2 weeks they start to see benefits. If someone has anxiety problems, we've got anxiolytics or anxiety reducing medications, which they can start taking. With a combination of psychological therapy and social support, so the holistic treatment, and we do see people benefit, but obviously it is does take time. So most people will start to take medication and they will see benefits within some. So for example, with something that's like anxiety or sleep disturbance, you can see an effect almost immediately. But the danger is we don't like people to become addictive to these medications, so we do also advise other forms of therapy. So that's where the psychology comes in. I personally have done CBT for other people, and I've seen the benefits of it, and I've seen how they've improved. So I think if anyone's struggling with depression or panic or OCD, anxiety, there is so many different types of CBT that we have, even for PTSD. There's different types of CBT that we have, so cognitive behavioral therapy. And what that does is look at our thinking, how it affects our behavior, and also gets us to try and think in a more positive way, for example, in depression. So that's what CBT does. And essentially, when a person does CBT, they start to see benefits where all the symptoms of depression start to improve and they start becoming more positive. The symptoms of the sleep disturbance, appetite, the negative outlook on life, those negative automatic thoughts, the feelings of helplessness, the guilt, hopelessness, and worthlessness all start to improve. And with CBT, we see people really improve. So all these treatments that are available have been tried and tested, and I think what's so important and amazing is that we do have treatments. And when someone is suffering from a mental disorder, they cannot see that they can get better. They might have dark thoughts and they can be in a very negative state. But I can personally tell you that from the cases that I've treated and from what I've seen of my colleagues treating in other teams, because we work in a team with other professionals, which is great. And when you can see someone improving day by day because of the holistic treatment and the interventions that are available, you can see that someone can become well, and we can promote people's well-being and recovery. And I think that's what it is at the end of the day, is to help each person on that journey of their recovery and well-being. So
Just
yes.
allow me to rudely interrupt,
Go
because
on.
we haven't got too much time. So if you maybe for the next 30 seconds or so tell us about help. Where can we get help when we
Yeah.
if we,
So there's different organizations. Every town in the UK, we're fortunate to have community mental health teams. We've got crisis teams, we've got early intervention psychosis, and different specialist teams as well. So I think if anyone wants information, they can Google and check their local health, mental health services. They can get help from their GP, their nurse practitioner. We've got the IAPT services for counseling, the intense access to psychological therapies, and a lot of charity organizations. I can personally say charity organizations like Mind, Cruise, 11-step program, 12-step programs like AA, Alcoholics Anonymous, or Narcotics Anonymous. So all of these are available online, children's organizations as well. So for every single disorder, you will have a organization that you can contact, and these contact details will be available online. I can provide you a list later on, Opoku, and then I can put that on my Facebook page and my Instagram, and we can connect that with the listeners so that they can have that information as well. But if anyone wants to contact me as well on my Facebook, Seshni Moodliar, or on Twitter, Dr. Seshni, or Happiness Psychiatrist on Instagram, or Happy Doctor's Kitchen, they're welcome to do that.
that's fantastic. And if you can, well, you'd be kind enough to just send me a text. So that
Yeah, can I also just say the Royal College of Psychiatrists, so www.rcpsych.ac.uk, has a lot of reader-friendly leaflets about different conditions, about the medication, about the treatments, and lots of resources, books. I'm very prescriptive. I've always give information about books that are useful. So please do have a look at their website as well.
fantastic. If you can add that to the list that you sent to me before the end of this show, then I can read it out. Thank you very much.
Thank you so much, Opoku, and have a fantastic day. And let's continue to reduce the stigma of mental health and raise awareness, which is so important. And, just to promote good mental health, like we promote good physical health.
Okay, bless you.